Rural hospitals in Texas have struggled with funding over the last decade or so as prices continue to rise, with reimbursement rates staying the same or doing the opposite. Uncompensated care must be performed for patients if they are uninsured or simply cannot cover the medical expenses by themselves, leaving these hospitals to cover the costs, typically without enough outside financial support. Tyler Dupnick joining us tonight with more on this reality. And Tyler, we know this is a problem across the state, but how about here in West Texas?
Well, Alex, it is a problem that we see here in our more rural communities. Although oil revenue has helped property values, ultimately allowing some hospitals to cover the cost of that uncompensated care through tax support. However, for those less fortunate across the Lone Star State, leaders are looking for other avenues to better health care in rural areas, with federal Medicaid expansion into Texas still unlikely. I was able to speak with Odessa State Representative Brooks Landgraf and others regarding that and more.
The Texas state legislature has enhanced state Medicaid rates over its last two sessions, but there are reasons preventing the state from welcoming federal Medicaid expansion.
Borrowing money at the federal level that we don't have, and with federal programs like Medicaid, there tend to be a lot of strings attached and one size fits all. So I think the leaders in the Senate, particularly in the governor's office, prefer a Texas-specific solution. And probably more of a free market solution.
The state of Texas leads the nation in uninsured patients at just under 20%, a reality that forces rural hospitals to bear the burden for medical expenses. Without federal Medicaid expansion, there is another option for rural hospitals to care for uninsured patients with financial gain.
We are, and every hospital is able to provide quality care to uninsured patients, with the expectation that we can access those federal charity dollars from uncompensated care. So there are ways to get paid for uninsured patients.
One other avenue in trying to better health care in West Texas is by increasing funding for college and university faculty to teach the next generation of healthcare providers.
If we can add state funding to make these teaching positions for nurses more lucrative, that can help fill and stop this nursing shortage that we're seeing in West Texas and throughout the state. This is an all hands on deck situation. We want to make sure that they have the resources to hire and equip teachers who can properly train a new generation of excellent nurses who will then serve not only in our communities in Odessa and Midland, but in other communities throughout West Texas.
Now, Landgraf also told me in our conversation that they are working on a Medicaid block grant program that would better serve health care and taxpayers in Texas. He also mentioned the importance of continuing funding for expanded broadband coverage to allow more Texans to access telemedicine and online health services. Alex.